So now we're on the final study that we're going to be reviewing. The study titled, quote, Mesotherapy with Dutasteride for Androgenetic Alopecia, a retrospective study in real clinical practices, unquote. And this study focuses on evaluating the safety and effectiveness of mesotherapy with dutasteride in treating androgenetic alopecia, commonly known as male pattern baldness, or female pattern hair loss, or pattern hair loss. Bottom line, it's that condition that causes your damn hair follicles to be sensitive to DHT and, over time, miniaturize. Now, this is an excellent study. This is a retrospective study conducted by David Corallo and colleagues, and it provides significant insights, but also it does have some limitations, so there is some room for potential improvement. The researchers conducted a multicentric retrospective study. The criteria for inclusion were patients treated for at least 6 months with mesotherapy using dutasteride. So patients were having dutasteride injected into their scalp. Anyway, the study aimed to assess both the safety and effectiveness of this treatment in a real clinical setting. A total of 541 patients were included, and the study collected data on demographics, clinical presentation, treatment details, side effects, and treatment response. With an analysis of the data and the results, regarding efficacy, the study showed notable results. Now, pay attention closely here. Only 86 of the patients out of 541 patients were actually treated with just only mesotherapy dutasteride. Now, why do I say this? Because other patients were treated with other things, including dutasteride and also without dutasteride, so it kind of muddies the results on what this 541 patients are actually being treated with. Because at a first glance, you may only think that only 86 people responded. No, only 86 patients received only mesotherapy dutasteride. So that means only 86 patients were having dutasteride injected into their scalp. So out of the 86 patients, which represents 15.9% of the total 541 patients who received some kind of mesotherapy, 86 patients only received dutasteride mesotherapy as the sole treatment and were evaluated after 1 year. Of these 86 patients, 71 patients, equating to 82.6% of these 86 patients, demonstrated clinical improvement. More specifically, within this group, 33 patients, or 38.4% of these 86 patients, exhibited a marked improvement in their condition. In terms of side effects, the study highlighted pain as the most common adverse effect. So the pain of having something, injected into your scalp, or just a needle going through your scalp in general, it's kind of uneasy. And this was reported by a total of 246 patients, making up 45.5% of the entire study group that reported experiencing pain during treatment. Now, there were other milder side effects that were also documented, albeit less frequently. These included frontal edema in 7 cases, a skin rash accompanied by facial edema in 3 cases, which required systemic corticosteroids for management, and a single case of local hematoma, and 1 mild case of folliculitis. The treatment regimen followed in the study was also important as an aspect. The most common frequency of treatment during the first year was quarterly, with 258 patients accounting for 49.7% of the total adhering to this schedule. Moreover, a significant portion of the patients, amounting to 378 individuals, or 72.8% of the total, chose to continue the therapy beyond the initial 12 months. So, what are the strengths of the study? It's a large cohort. The study strength lies in its large sample size, providing, somewhat of a robust data analysis where you can see the different treatments that people had and you can kind of compare them, right? But there was no control. That's for the negative aspect of the study. And not only was there no control, the downside is many of the patients outside of the monotherapy group, outside of the group that was only receiving dutasteride mesotherapy, so that only being 86 patients, all the other patients were on concurrent treatments. They were taking minoxidil, finasteride, spironolactone, dutasteride orally, just patients were using other things outside of those 86 people who only received mesotherapy dutasteride injections to the scalp. Many patients in the study were receiving other hair loss treatments, and these treatments included oral dutasteride, being 393 patients, oral minoxidil, being 154 patients, oral finasteride, being 32 patients, and oral bicalutamide, I would never fucking touch that, by the way, being 14% of patients, and finally, oral spironolactone, something as a man, you don't want to fuck with, but that's about 5% of patients. So, in the context of this study, the breakdown of patients receiving various treatments, being oral dutasteride, oral minoxidil, etc., adds up to the number greater than the total count, being 541. So, all the numbers that I just listed out, if you were to add them up, you may think, hold on, that's more than the sample size. That's more than the 541 patients, because I mentioned there being 393 patients, 154 patients, 32 patients, 14 patients, 5 patients, each respectively either taking dutasteride orally, oral minoxidil, oral finasteride, oral bicalutamide, or oral spironolactone. So this apparent discrepancy arises because many patients were receiving more than one type of treatment concurrently. For instance, a patient may be using oral dutasteride, might also be using oral minoxidil, or even another oral treatment at the same time. So you do get a degree of like double, maybe triple, quadruple, who knows, counting. So although when we add all these numbers up, they do exceed 541 patients, that does not indicate an error or larger study size, but rather it illustrates the overlapping nature of treatment regimens among the study participants. Each patient, again, could be part of multiple treatment categories, leading to a sum that surpasses, the total count. The concurrent use of multiple treatments in this study as well really does obscure the specific effectiveness of mesotherapy with dutasteride. Because we're trying to see just mesotherapy with dutasteride alone, we want that to be the major focus. But I must reiterate, 86 out of the 54 patients only received dutasteride mesotherapy, which is dutasteride being injected into the scalp. And of these 86 patients that received dutasteride mesotherapy only, 71 improved in the first year. And this comes up to 82.6% of those 86 patients improving. Now, I wish they simplified the study and they just got 541 patients in total, and they split it in half, one receiving just placebo, the other receiving dutasteride mesotherapy injections only and nothing else. Because that would make a really good, study. And if it was double-blinded and randomized, that would be fantastic. Another aspect that I mentioned before in the other sections was that I would really like to see these studies start looking at scalp biopsies to monitor the reduction in scalp DHT and also the reduction in 5-alpha reductase enzyme in different parts of the scalp. So if they were to compare this from baseline to after treatment, that would be fantastic. And it would actually, show a greater range and distribution in terms of what we know about the different 5-alpha reductase concentrations in the scalp. So whether or not type 1 tends to be overrepresented in the hairline, whether or not type 2 tends to be in the occipital region, parietal lobe, whatever. And also monitoring other enzymes like aromatase. This probably would have made this study fantastic and very robust. And yeah, again, like I said in the other sections, if a researcher is listening to this, definitely do something like that. I think that would be very valuable in the world of dermatological treatments. Yeah, that's fantastic. Now, although we're largely done with reviewing this study also did a sort of medical literature review on mesotherapy dutasteride, because there's this table that actually shows a summary of various medical interventions that involve mesotherapy dutasteride in treating hair follicle miniaturization in androgenetic alopecia. And I don't want to go through these studies one by one because we kind of actually covered some of these already in this video. But yeah, I'll put a screenshot here and I'll read some of the notable ones. For example, Morales-Miranda et al. reported a 100% improvement in their small study of 5 men using 0.01% dutasteride over a 6-month period. And this is what I'm presuming to be mesotherapy or topical dutasteride, but I think it's mesotherapy dutasteride. So I would rate this study overall as being pretty solid because although it didn't have a proper control group and there was a bit of obfuscation, it did show that within the group that was only being treated with mesotherapy dutasteride and nothing else, that 82% of them, or 71 out of the 86, experienced hair regrowth within the first year. So yeah, I think that's pretty fantastic.